Today, the executive director of the Department of Juvenile Justice went before an advisory council to talk about plans to improve the facility. This comes after multiple incidents at DJJ involving both students and staff over the last several years. Jalen Tart reports.
Eden Hendricks spoke to an advisory council about plans to improve the conditions of DJJ. One recent problem at the facility involved 16-year-old Easley Jeffcoat, who attempted suicide at the Willow Lane Infirmary at DJJ back in December. Prior to that, in 2022, a worker was attacked and seriously hurt during a riot at the facility. Also in 2022, a 13-year-old was found with a loaded gun. Hendricks says a number of factors have led to the overcrowding, including a new law that was passed in 2019.
So after the pandemic, there's been a strong uptick in juvenile crime, and so we have really felt the impact of Raise the Age. So now all 16-year-olds are considered juveniles and are all housed in our detention facility. And so that means all 17-year-olds who commit mainly nonviolent and gun charges also come to DJJ. And so we are having to house all of those in the same detention center that was already crowded before this law went into effect. And so that's some of the reasons for the overcrowding at the detention facility.
During today's hearing, Hendricks presented several steps to improve the facility, which includes higher salaries for administration, building new facilities for renovation, and better technology and overcrowding at the detention center. WIS previously reported on the state legislature allocating $20 million in the state's budget of 2022 to build a mental health facility for DJJ students. Hendricks explains on how the facility can be a solution to assist those dealing with mental health issues.
Once it is built, it will be a really, really good option, but we have a lot of issues going on until then. I mean, that was back in 2022 when we got the money. So in the interim, like I said, we have worked with DHHS to raise the Medicaid rates to hopefully get more of our youth in there.
With construction not yet starting for the new facility, Hendricks believes that an interim plan to find placement for the youth.
We've also really worked collaboratively with the governor's office, Senator Shealy, Department of Health and Human Services, Department of Mental Health, Department of Children's Advocacy to come up with interim plans until this building is going to be built.
Hendricks tells me that the construction of the mental health facility is set to begin in September. Reporting in the newsroom, Jalen Tart, WIS News 10.